I would say my top three positions is I'm trying to maintain and build and maintain deep trust with the community, the residents we serve. Because without trust, which also involves transparency, we as cops, we as police can't do our jobs effectively. Because if the community doesn't trust you, they're not going to work with you to achieve the safety we're trying to achieve. My second main goal is to fight the gun violence occurring in our communities and get illegal guns off the streets and out of hands of criminals, because too many homes, too many families, too many neighborhoods have been shattered by shootings and murders and senseless killing, and we have to bring that down. And the third thing I want to do is to bring a non-police response to mental health, homelessness, and substance abuse, because we can let the police go and handle public safety and crime and have a civilian entity, a civilian unit made up of behavioral health network specialists who can go respond to these non-violent mental health crisis calls and respond to the homeless population and substance abuse. All three intermingle, homelessness, substance abuse, and mental health. And it creates safer outcomes and better outcomes for the community.
I think that's huge. And because we're asking a lot from, and not just because I'm walking in the shoes. Right now I got Crocs on, by the way. I would have for sure got beat up on the subway. On the metro. Hey, you got Crocs on!
Give me them Crocs.
Yeah. But I think it's huge for law enforcement that we're asked to wear so many hats, right? And we might be kind of good at this, kind of good at that, a little bit good at this, but we're expected to be as like we went to school to understand mental health, and even though we can identify some signs, but it's really you're asking a lot. So to have that, go ahead.
Yeah, we're expected to do everything.
Right.
It's not a lot. Everything. The police are supposed to handle everything.
Yeah.
And I've said as a major in the community when I've gone out is that we, the police, can't do it all.
Yeah.
It's 100%. We can't do it all. We should focus, and that's what I want to bring a mission back to Miami. This is our one mission, focusing on public safety and quality of life. But we get 40 hours of mental health training, a week. Mm-hmm. Yeah, we might know a little, but to handle all in my career,
one training for 40 hours that week.
Yeah,
not every week 40 hours.
No,
a week.
And not annually retrained.
Yeah.
There are some units. There's one unit now that is getting some retraining in mental health, our crisis response unit. But the general populace of the department, the personnel, if you get the training, is 1 40-hour week, your career.
Yeah.
And there are other agencies here in the state of Florida, Orlando Police and St. Petersburg Police, which are much smaller than we are, have less resources than we are, because as I said before, we're the largest agency in the southeastern United States and nearly $1 billion budget. But if Orlando PD and St. Petersburg can do it, why can't we? We should be able to do it. And they have partnered with a local behavioral health network, and that network hires more folks. And those folks, when someone calls 911, respond to these nonviolent mental health calls, because the only number people know to get the government at 10 o'clock at night when their son, their family member is going through crisis is 911. There's no. Let me get the. They don't necessarily want police to show up.
Yeah.
But they want help for their son or their family member, and so those units, like in Orlando and St. Petersburg, they send mental health clinicians, and due to that, they can see what the person was diagnosed with, what medications they ever were given. We as cops can see that. HIPAA laws. So the fact that they work under a behavioral health network, they can't. It's a better outcome.
Yeah.
And then they can get the resources that person needs. So they're basically like community health responders.
Right.
Because the police shouldn't be going to everything. We shouldn't be expected to handle everything, because like I said, we get trained, and there should be a focus of that training on getting the bad guy in jail, getting our streets safer. For some of these more vulnerable populations, they need better solutions, and I as sheriff intend to bring those better solutions to this county.
I like it. And just to go back, and and I don't know your position on it, and I'm sure is what I'm about to say, is that there's going to be, for the listeners that are like maybe naysayers, I'm sure there's a threshold, right? So if there's somebody with a mental health crisis and they have a knife and they're going berserk in their house, and they're like, hey, this person didn't take their medication, send the mental health person, the officer, not the officer, what'd you call him?
A
The
community
behavior-
health, behavioral health specialist.
Send the behavioral health specialist over here. People are going to be like, great, you're going to get people stabbed
Yeah.
up.
I know
sure.
you have and that's why also like I said, I want to do many things, and one of the things I want to have is like a community council, the sheriff's community council, having community members from all of our 13 county districts to form a council, so that when we're forming policy or doing police initiatives, I can sit with them, they can sit with us, we can share ideas, because education is a big part of it. And if you just throw something out and don't preface it and explain it correctly, you're going to get folks who will misunderstand. And that's why I said it quickly, but I should, explain it. Like I said, non-violent mental health calls.
Yeah.
Once there's a threat of violence, someone that may be injured, if they have a knife, if they have a gun, the police are still going to have to go, because then that becomes a public safety issue.
Right.
But if the non-violent calls, I've been doing this job over 17 years now, and I can tell you the majority of our calls are mental health crisis calls. We call it Signal 43, and they are going out constantly. We're having our cops go to these calls, and like I said, they have 40 hours of training, but then they also have a lot of training on, ECW. They have the tools on their belt,
which is essentially the taser.
Yeah. So when the conversation breaks down and the person, we can get outcomes that we don't want,
Right.
And so if there's
so essentially what you're saying is you train this guy how to use a taser, how to use maybe to restrain people, this and that, when not so much in the verbal communication, identifying behavioral mental health issues, and being able to identify that stuff and learn and give them the resources, which essentially is that verbal taser or that whatever, you're going to get what you trained them in.
Yeah.
Well, this is what I know how to do.
Yeah.
So A, B, and then I must use C.
Yeah,
You know?
A didn't work. I got to go to B. And B, yes,
Yeah.
and so
Okay, I got you.
Yeah, so that's why I'm trying to bring
like
this because I think that civilians can do more, and civilian staff, professional staff can also be first line responders to some of these calls.